the mummy has risen. I'm still in this creepy hotel, Matthew Walt.
You are wearing the mummy gear. It looks like the wrappings are all coming off, and they just found,
I know.
They just took it off your head, and they found this face underneath you.
I've got health tech companies that are back from the dead on the May 5th episode of Health Tech Deals. Well, this was an unfortunate outfit choice, but I'm glad we're rolling with it.
Glad you have still some clothes to wear, given you've been traveling all over the world and back from your yoga cult retreat in...
Yeah. Hey, catch me up on what's going on with Amazon. Like, what is this, like, pill pack thing that's happening? Tell me about it. Tell me.
Aaron Broadwin reported in this in Axios that Amazon apparently had been... I'm a bit confused at the pill pack. They had been sending out more insulin than they should have been and charging more for it or something. I'm a bit confused. And that it had been reported up the chain and no one had done anything about it. And it's unclear as to whether this is now or this is the reason that the folks originally from PillPack got kind of semi-booted, although they're still employees, but they're not running the show anymore. The two original founders. What's interesting is they were on Twitter the other day talking about how, well, actually they had never sent out prescribed substances like our friends at TruePill had done, and they thought it was just too complicated and there was too much risk associated with it, which is, I guess, okay, because, why should you do it? Because so many other people are in trouble. On the other hand, we like saying no one should get prescribed substances. But yeah, I don't know exactly what the ramifications is going to be of this. Were they overbilling for insulin? Were they sending out too much? Because this was for Medicare and Medicaid, so this could be nasty federal fraud charges.
Is this going to be the unraveling of this whole direct-to-consumer prescription?
I wish there was like a long thing to pull off you and you would spin around in like some kind of mummy's thing, but you're just wearing a trendy. I bet that sweatshirt cost you like $400.
Listen. I would never pay that much for a sweatshirt, but
it's got a lot more strategically placed holes than mine do.
I keep getting attached to things, so
I'm not surprised. All right, you ready to do our deals? We have a bunch that have been around for a while.
Yes. Okay, back from the dead. Here we go. All right, Levels gets 38 million, brings your total up to 50 million. This is a blood glucose CGM, but it's like fancy dancy. Tell me more.
Yeah, well, so they use the blood glucose CGM and then do lots of analysis on it. This is for sort of the worried, fitness warriors, athletes, that kind of stuff, and they're trying to spread it. And it's basically a really complex analysis of your blood glucose, what happens, what should you do. Really interestingly run company, which via a syndicate I have a teeny like $2,000 stake. They raised this money mostly from a bunch of big operator investors and from their current customers. I think it was A16Z read the original round, but this is our 38 million round. We will see whether this stuff has always had trouble getting beyond the kind of early enthusiasts, but their early enthusiasts are clearly enthusiastic enough to put in a lot of money. So
Let's
maybe
see.
It's a big deal.
All right, what about Waltz Health? They get 35 million. GV's in this, Define Ventures again, twice in 2 days. Echo Health Venture, Blue Venture Friend, a whole bunch of others.
Yeah. A stellar lineup of people. It's a marketplace search engine. It's a marketplace for searching for drug costs, right? The guy from OptumRx, Mark Theory, is the former CEO there, is the CEO. It apparently is going to use data to tell you about different drug discount programs to get to the right medication. And I cannot tell why this is any different from GoodRx. I don't understand it at all.
All right, health insurance for nomads. I need this. 25 million safety wing.
Yeah, I mean, again, I think it's US-based nomads going out to other countries and they're going to sell you insurance. Most other countries, healthcare is super cheap, so you don't need it. So, I don't know. Maybe it gets you back to the US if you need heart surgery. I don't know. Founded in Norway, one of our favorite places, now the US.
All right, speaking of hearts, cardiac RPM company Implicity gets 23 million.
Yet another cardiac RPM platform. This one is doing, device-implanted cardiac devices. It's French. That's the difference.
Oh, okay. What about health maps?
You hit the button. Too late. I'll do it.
I said it.
You on that or not?
I feel like I didn't hear the noise until after I started, but you tell me. I'm having trouble hearing over the construction noise outside of this creepy hotel, so you tell me if I was there.
Good to see the infrastructure things going. Well, let's leave it for next time.
Oh, cliffhanger.
I don't think you're close to making it. So I think we got to have some rules. Otherwise, it's anarchy. And
yes, because this show, stickler for following the rules.
All right.
Again, there isn't even anything to say about it. That's just so ridiculous. But okay, we'll save that one. The suspense is gonna kill people, so yeah, we'll just save it. We
will see you next week. I understand we're gonna see you after your niece has had her baptism, first communion, something. What's going on with that?
Yes, I'm going to Chicago. My niece is getting baptized on Sunday, Mother's Day. It's Mother's Day. For everybody who might forget, you heard it here. Health Tech Deals. Healthy little reminder.
Your niece is getting baptized on Mother's Day. Isn't that a conflict of interest or something?
In what way?
I don't know. I mean,
conflict of interest. Whose interest?
Beats me. I don't understand. All I know is my daughter is having a sleepover. It's her birthday on Sunday. She's having a sleepover with some friends the night before. And then they're all going to have to leave on after Mother's Day. But her soccer team is playing on Mother's Day, and they put an appeal for players because they haven't got enough. I don't know whether we'll have any Mother's Day. The mother is right now in bed with COVID and not looking great. So
no! And she got it from you, huh?
Well.
All right. Well, get well soon to everybody over there, and for the rest of you guys, take care. Follow along with the exploits of Matthew Holt Mother's Day weekend. He's at Bolty Boy. I am at Jess Tomasa. And put that little hand down. Don't rush me. Your hand's gonna get tired. You're gonna hold it up. And to never miss an episode of Health Tech Deals, sign up for the email newsletter over there on the healthcareblog.com. You get the best of the blog, plus these cute little episodes and my WTF Health interviews delivered directly into your inbox whenever we feel like sending that thing out. Yeah, now I'm done.
Okay, well, have a good exit from Boston, and we'll catch you wherever the hell you end up after Chicago.
Ta-da!
Who knows?
We'll see you later. Bye.